So I know folks are still going to be coming in as well, but I wanted to introduce our panel and get started. First, Pam MacEwan, the CEO, the interim CEO of the Washington State Health Benefit Exchange. Tony Armada, the CEO of Swedish Health Services. And Erin Leff, Executive Vice President at Group Health. Thank you all very much for being here. Ostensibly, the topic, and Sam, can you bring up the slide deck for me? The topic today is about leadership through times of change, implementing reform in times of challenge, challenge politically. But that's a long-winded way of saying, as we see this panel really as a conversation about leadership. Because regardless of the political winds, the work of healthcare needs to continue, and sometimes the work of the private sector outpaces public sector. Sometimes public sector and public policy impacts the private sector. And so we thought that we would do, like last year, we would have that conversation through the foil of our 2016 Washington Healthcare Executive or Healthcare Leadership Outlook Survey. And so this slide deck is on all of your USB drives. And I've selected some slides from that for our review and discussion here. And I'll use this just as a little bit of a foil to have our conversation. First, this is about 520 responses of our universe on our email list. We don't pretend to say this speaks for all of the healthcare sector. We just say this is 520 people on our email list or who received our email and forwarded it as a response. And I thought this was interesting, and Tony, I'll start with you on this. First, generally speaking, how do you feel about the future of healthcare sector in 2016? Would you say you're positive or negative? And the positive combined, very positive and somewhat positive, is about 53 or 54%. Last year it was 62%. And I wonder, I think it's probably native to an executive or leader to be optimistic about the future. But I'm wondering, do you see any transition in terms of optimism versus pessimism in the conversations that you're having at Swedish?
Well, I think some of the outlook that's being described now is really more of the experience and reality of the challenges we have to do from shifting from fee for volume to fee for value, right? I mean, if you're stuck under the normal paradigm of delivering care in the same old way for the last 10, 15 years or so, I think you will struggle, and you won't have as high of optimism in terms of the future of healthcare. And there are people and organizations out there that truly are looking upstream and understanding what they need to do to continue to move the needle on their initiative to fee for value. Yeah. And those organizations feel more positive about it than not.
You know, let me pose an observation about Providence that I have in conversations with executives there and ask you to respond that as the largest provider in Washington State and a huge multi-state provider with the St. Joe's Initiative, as I mentioned earlier, it'll be about 50 hospitals stretching from Texas to Alaska based on affiliations. You know, at a certain point you get big and you get sort of static, and Providence is not, like everyone I talk to is trying to hustle. You know, they are worried about getting faster, bigger, moving more quickly, consolidating, not consolidating per se, but just very thoughtful about leading into the storm of reform. Not all providers have that perspective. Maybe offer some insight about what some of the thinking is there at the strategic or cabinet level that is driving the innovation at Providence.
Well, I think first of all, we do have guiding principles in terms of how we partner, affiliate, or merge. One of them is really being very conscious of the marketplace we're serving. In some respects, we have taken the initiative that in every marketplace that we serve will be a number one and number two provider. You know, we also take a lot of time in making sure that from a mission and values alignment standpoint, that the organizations that we are combining with will have that same type of characteristics and how we promote and take care of ourselves. And then the other thing too is that in a lot of our affiliations and partnerships, we really don't have any overlapping markets, right? So we're not competing with each other. And the whole goal of consolidation is not only to create a better framework for safety and quality, a better economic model to take advantage of the economic factors of bigger isn't necessarily better, but bigger can translate to more efficiency. And it translates to more population that we can serve. And that's true with some of the affiliations that we've done at Providence in the state of Washington. It's true in terms of our future new company now with St. Joe's, creating Providence St. Joe's Health. And if you really look at it, you know, it's good or great organizations coming together in non-overlapping markets to take advantage of the scale of now being a Western States delivery network.
Good. Let's jump to the next slide here. In addition to your general outlook, which of the following adjectives more specifically describes your outlook for 2016? Challenge was number one. I know it may be tough for you to see down there, Erin. Challenge was number one, engaged, number two, and anxious, number three, frustrated, number four, and optimistic, number five. Frustrated was pretty low last year. You know, those are, you know, challenged, engaged, anxious, frustrated. Those are sort of positive, negative, neutral. I mean, anxious is a little negative, but generally speaking, people are hustling, right? You work with providers at Group Health. One of the things I think that's endemic in the industry right now, and particularly providers, is this fatigue that has set in from all of this frustration, challenging engagement. Talk about keeping people rowing in the same direction when everyone's getting tired of rowing. What's that like at Group Health these days?
Yeah, it's interesting. I actually, over the holidays, was sort of catching up with my husband a little bit, actually, and who turns out I really still like, so that's good. But, you know, I said to him, this past year, in many ways in healthcare, has felt like some of the most intellectually challenging and rewarding times of my career. I mean, really solving complex problems. But at the same time, it's been the most emotionally trying. And as I talk to other executives and leaders in the healthcare space, I hear the same thing over and over, that it's incredibly rewarding, but really hard. And I think you're seeing that reflected here. In terms of how we've really been focused on keeping everybody inspired and working on the same page and in the same direction, I think more than ever right now in healthcare, we have a really savvy workforce. People are smart, they're reading the news, they're deeply immersed in sort of the macroeconomics that are going on. And in fact, when we recently announced our potential acquisition by Kaiser, I've been spending a lot of time rounding out with our staff and providers through our medical centers, and one of our nurses said, you know, we're really not surprised you'd have to be living under a rock not to be paying attention to all the movement in the industry. And, you know, 5 years ago, you wouldn't have had the same kind of sort of deep insight into the market, I think, that so many of our teams have today. And so that sort of insight, that paying attention to those trends, helps people really understand that we're in this rapidly evolving marketplace, and they want to know what's going on. They want to know what our strategy is. They want to know what our 3-year plan is. They want to know how they can engage to make the organization a better place and how they can contribute. And so those conversations are actually a lot easier to have, I find, over the last few years than maybe they would have been 5 or 10 years ago, because you have this incredibly engaged, passionate workforce who's savvy and who wants to be involved. And so and I think, again, this is not too uncommon, but we really try hard to be really transparent, to be really clear about what our 3-year strategic plan is, how that translates into an annual operating and financial plan, make sure everybody knows that plan, make sure they understand what their part of that plan is, and then make sure we're clear about how we're performing against the plan. And that's what we focus on. And again, it seems like that's easier now than maybe it would have been in the past because of all of the consolidation and movement in the industry.
So let me ask this question, which is, some people are commenting, and I see the validity of the comment, to me at least, that there's this, it feels like things are kind of entering a period of stability. We've come through a very transitional 5-year period, and that maybe we've kind of, as Rick Rubin commented to me, we've been in an inflection point. And it's a question of whether, we're not going back, but the question is whether we're going on to something bigger and farther, or whether we're done. And I suspect it could be any number of those things. We're used to the group health, given the relationship with Kaiser. How do you feel like things are? Are things starting to stabilize?
No.
Or are they starting to get crazy?
No, I don't feel like
Right.
we're done. I don't feel like we're done at all. And I mean, I think that's another thing that's changed is this sort of. I think people are much more, if not entirely comfortable with the pace of change, a lot more cognizant that this is the new normal, and that sort of stabilization, as we used to know it, is not the case anymore. I mean, we used to hire people, and you'd say, we want you to bring you in at this level, and we expect you to be here with us for 10 years. Well, you can't say that in healthcare anymore, And the other thing I think about is, again, just this sort of the savviness and this connection with the market. Who would have predicted a couple years ago that an organization like Zoom Care would be a threat to both delivery system and health insurers? Well, now that's a real threat. And there's all of these emerging companies that are sort of coming out of nowhere and really challenging that traditional model. And so I don't think anything's staying the same. And again, I think people are savvier about understanding that. I don't know that leads to any less anxiety, but I think people understand that.
Yeah, good. On the next slide here, generally speaking, Pam, I did this to Representative Cody and Senator Parlett. Generally speaking, how would you rate the performance of Governor Jay Inslee on healthcare and health policy? He's at about 43% or 42% there. He was at 45% last year. This is generally reflective of a recent poll that came out on Tuesday from Stu Elway that put him at about 39% from the public at large. What would you're stuck in an elevator with the governor. What would you say to him about what you need at the exchange to be able to be more successful or even more successful in the work that you're doing?
Well, first of all, I thought we covered this topic at lunchtime.
Yeah, but you're in the elevator now.
So actually, if I was in the elevator with the governor, the first thing I would do is actually thank him for the support he's given to the exchange. We had, as many of you know in this room, we had a very tough battle regarding the budget, and we had excellent support from the governor's office and OFM that helped us through that. And it's been a behind-the-scenes support, but in terms of appointments to our board and support through Bob Crittenden, it's been very positive. But I would agree with what Senator Parlett said at lunch, which is that I think we all know that healthcare is not his passion, and that he thinks more in terms of environmental health that's related to environmental improvements, but also public health. Yeah. And I think in the sense, I would actually like to see him do more in that area, because there's plenty of disruption in healthcare. There's plenty going on at the exchange and with organizations like Providence and Group Health. And I think someone needs to start thinking of a bigger vision of things that will really actually make difference in the health of the people of Washington State.
I believe, I can't recall with precision, but the former chief information officer, I think left in the first quarter of last year. The exchange's CEO and CFO left in August of last year. That's sort of decapitation for an organization. I mean, to use a very strong term, that's very hard for an organization to continue when you have that much leadership at the same period of time turnover. Yet you stepped in, kudos to you, I think, and to your team, are getting through open enrollment. What has that been like for you personally to step into a real challenging HR situation?
I was really ready to step in. Richard, who is Onitsuka, our former CEO, he and I had a close working relationship, and he was pretty exhausted, and understandably. it's not surprising that a startup would have this kind of turnover at this point in our development. So I think we were well prepared for it, and because I'd been deputy there and working on a lot of improvements, I was very well prepared to step in. And personally for me, it was very exciting because I was able to jump in and make some changes of things that needed to be done. We, for those of you keeping score, we needed to remove premium aggregation, and I guess this is supposed to be the wonky session, so maybe people know what I'm talking about. But that was a major IT improvement that needed to be made, and I was able to really guide those things through, and we got really positive results. And we've brought in some new leadership, and with high energy who are ready to go. So for me, it hasn't been daunting. It's really been helping the exchange take that next step in our development.
You've felt challenged, engaged, anxious,
all that
frustrated.
list that you showed, Erin,
Yeah.
I would check all of those off as well.
Yeah. Good.
On any given day.
So we listed about 25 different organizations and asked folks to respond about which they thought more positively about and others. This is the top portion, a little more than half of those. Seattle Children's was #1 last year as well. Polyclinic shot up. Virginia Mason moved up. Everett Clinic moved up. One thing that stands out to me on this, maybe Erin, I'll ask you, since you wear both hats of provider at Group Health and also a plan. For all of the marketing and community outreach, provider organizations are still at the top, and health plans are still at the bottom. MODA comes in last this year. You can see the rest of this content on your flash drive. Any observations about that, about just the challenge of health plans getting good sort of social capital or working capital with the community, and providers, sometimes providers are slow to change, and they can say, hey, look, we're loved, we don't need to change.
Yeah, I think it's a really good observation. All of our market research affirms this as well, too. Healthcare is local, and patients and their families connect with their healthcare provider, with their doctor, with their nurse, with their clinical team. And so it's not surprising that those provider groups tend to be ranked more highly. And I think people have a bit of a native mistrust about insurance companies. And so there's definitely more of a negative brand perception about a health insurer than there is about a healthcare provider. And that's not unique to this market. You'd see that play out across the country. Mm-hmm. So that doesn't surprise me. I think you're right in that it can go the other way, which is some of these insurance companies are actually doing really innovative and incredibly consumer-centric and patient-centric kinds of things. And meanwhile, some of the provider groups are slower to change. Again, though, what I think we're seeing, not only at Group Health, but really across the state, our organizations are having to be more nimble on both sides. Increasingly, provider groups are starting to get in payer arrangements, and some of your historic insurance companies are starting to buy provider groups. And so that distinction, I think, is really starting to be not as clear as it used to be, and so it's forcing a new set of capabilities. And I think the good organizations are looking at the market and saying, we're going to start with what the patient wants, with what the consumer wants, and we're going to figure out how to get better and innovate around there. So I think you're exactly right, but I also think those lines are starting to blur a little bit.
Tony, I want to ask a little different question based on some of the stuff I've learned today and last night. And this is really in Erin's wheelhouse, but I want to ask you about it. I learned last evening that Kaiser in California, at least, and I assume this is system-wide, retrains its providers for a period of about 18 months. So as soon as a physician, or I think this is actually just physicians, but it may be also nurses or other providers, but when a physician joins Kaiser, they go through a period of essentially retraining and recalibration. 6 months, they don't do any patient care, for instance. That strikes me as kind of, and of course they've just announced the opening, probably in San Diego, of a new medical school that Kaiser will own and operate. That seems like a very damning statement about the quality of medical education in at least California. I know we're better here. What are you seeing in terms of culture and attracting and retaining great physician leaders who are also great clinicians? Is our medical system, education system, doing well enough? Does Swedish Providence have a retraining model as well? I'm interested in your observations there.
Well, I think the one observation for me is really the medical education program has not changed for how many years, right?
A lot of them.
So part of me is saying, we just can't keep training the same way we have been for 100 years and expect different paradigms or different ways to look at how to deliver care, right? I think the second piece for me is in the whole notion of how we deliver care, right? Because if you look at Kaiser, for example, and I was with Kaiser from 2000 to 2004. Kaiser looks at things from a whole continuum of care, and if we look at population health, or you look at what's going on in the marketplace and the demands of the future, that is where the puck's going, to provide value-based care, right? And so I'm not surprised at all that if you have a cachet of about 6,000 physicians, and you're looking for a certain way that you want to train people to deliver care, and you have to have your own type of career ladder or bench strength mechanism. I'm not surprised at all that they made that announcement.
Yeah. I ask you in part because I know, excuse me, Swedish and Providence takes a great deal of care and attention to culture, internal culture, and
so at Providence and at Swedish, we have our own set of onboarding of our physicians, to make sure that they're there to create that venue for best safety, best quality, best health outcomes, and best experience, right? But it's not a 15-month period, right? Yeah. Keep in mind that for the most part at Swedish, we're still a very pluralistic model where only 30% of our doctors are actually employed or in a staff model. 65% of our doctors are still in big group practices or private practice models.
Interesting. Next question was a general question, specifically to what the healthcare authority is doing. This has been on the screen. It's related to the 1115 waiver, and asking about relative support and opposition to the healthcare authority's submission of a CMS 1115 waiver. And generally speaking, it was 46% was supportive, only 19% was opposed, but about 20% had no opinion. I won't ask about the 1115 waiver. I just want to note that to our audience, but I will ask a comparable question, Pam. I asked the question of Nathan and our lunch panel about whether Medicaid was paying its fair share to support the exchange. And I am of the opinion that exchange funding will continue to be an issue in the legislative session. I think we heard that from Senator Parlett today. Should Medicaid be chipping in more, or is the deal struck around Medicaid's funding of the exchange, is that adequate?
I think Nathan really handled the question well, and I'm going to repeat some of what he said, which is that I think initially we didn't calibrate it correctly because we estimated that far more qualified health plan people would enroll versus Medicaid. In fact, the Medicaid response has been overwhelming to the state, and it's actually undiscussed that 1.8 million people qualify for Medicaid in the state. I don't know what that says about the distribution of income in our state, but that's another conversation. So that really, we had to go back and redo the formulas, and we came up with a mechanism to do that. That was initially a little rough, and then we've continued to refine them. And the relationship between healthcare authority and the exchange have been very collaborative on this front because we actually have the same interest in having it right. We are able to draw down funds from the federal government based upon our Medicaid enrollment. So we want to get it right, and we want to maximize our ability to draw down those funds. And there will continue to be refinements.
I think the Senate Republicans in particular, but also the House Republicans would say, we want an exchange that is fully self-sustaining, and they would define that as, I don't want to speak for them, but I think in hearing what they have said, I think they would define that as an exchange that operates just by the premium tax, and or maybe not even that, depending on some legislators.
Depends on who you talk to.
But the fee, the QHP fee assessed for every premium that is purchased, or product that's purchased on the exchange, is that a business possibility or reality that the exchange can grow enough so that they won't need any financial support from the legislature other than the premium tax and the QHP assessment? And I think that number is I think it's a $40 to $50 million, or maybe not that much, but it's in the tens of millions of dollars.
Yes. I think it is. I think we're big enough state to be sustainable. Some of the other state exchanges, for example, Vermont and Rhode Island, are discovering that they're too small to really have their own exchange. Washington is actually one of the larger state exchanges, and we are large enough to be self-sustaining. And self-sustaining would be a combination of the premium tax, which is associated with the enrollment in the exchange, and the assessments that's charged the carriers from QHP, and then the Medicaid funds, that because we're the portal for Medicaid. The state gets tremendous value out of having a single portal for QHP and Medicaid. And we're already kind of living within that envelope. The state gave us additional funding this year that I think helps us through this transition. But we're very intent on growing enrollment, and I think the way to reach sustainability is through growing our enrollment. My concern is not the day-to-day sustainability, it's IT improvements. And IT improvements are very expensive. There are antiquated systems in the state that we have to work with. We have tremendous health literacy issues. We could build fantastic decision support tools for consumers. We could build tools that help with transparency. That's all investment dollars. And I'm not sure that we will be able to generate investment dollars. And we're going to have to look to the state or other entities for that kind of investment.
I want to ask all three of you this question. Just try to encapsulate for me how you might answer it. During times of tumult in our industry, particularly those that are brought about by political tumult, you might have a little more in the exchange today than other folks might have had in different points in the last 5 years. But what are your leadership sort of North Star guiding principles or principle? What is the one thing that you sort of put on your wall or remind yourself and your team to keep in mind as you're trying to get through a challenging period where the future is not clear? Tony, let me ask you first.
So, our guiding principle is best safety, best quality, best health outcome, best experience, best practice, and work environment for our caregivers.
Wow.
And that's a guiding light of how we decide, how we look, how we fund, and more importantly, how we measure.
Yeah. Erin, how about you?
Yeah, in a similar vein, in the care delivery system, safety comes first, absolutely, hands down. We're here to serve patients, and that needs to rule everything. But I would say on a more personal leadership level, there's two things. One is to trust my gut, and particularly at a time right now where so much is changing so fast, I remind myself of that a lot. And the second is to take a deep breath. I'm amazed by how much of the time we as leaders spend just sort of saying to our teams, okay, hackles down, take a deep breath, assume good intentions, let's breathe, and we'll get through this. And I think especially now, that's really important.
Yeah. Yep.
And we're completely focused on our customers. We had the unique opportunity of the exchange, which was to implement the Affordable Care Act in our state, and the sense of mission in the exchange staff to do that successfully is really inspiring. People have worked incredibly hard to make that work and continue to just work their hearts out to, now that it's stable, to kind of take it to that next iteration. And we've done more in 2 years to get people covered than I was able to accomplish working on health policy for the previous 25 years. So now we're focused on those new customers who have never used the health system before, and really the disruption that we've kind of unleashed into the health system, and how to take that to the next step, and what do we do for those customers to kind of create the transparency and the empowerment that can really start to change our health system.
It's a powerful statement. I mean, not one that we don't know, but it's in stark relief when you say we've done more in the last 2.5 years than we had in the previous 25. This is the last question we collected. It was new and specific to this year, and I think pretty stark. In the last few weeks, a number of consolidations have been announced in Washington State. For example, Kaiser is acquiring Group Health, Healthcare Partners is acquiring the Everett Clinic, Molina is acquiring the Medicaid assets of Columbia United Providers. Generally speaking, is the increasing rate of consolidation and market activity something you tend to view positively or negatively? And 50% said they view this negatively. Only 28% said this was a positive. Erin, I thought you had an interesting observation about the necessary segregation between strategic leadership and other parts of a healthcare organization when we talked about this previously. Share that on asymmetric information.
Yeah, it's been, again, my earlier comments about having the real pleasure of talking with hundreds and hundreds of our staff and providers over the last several weeks since we made the announcement about the Kaiser Permanente acquisition of Group Health. And on one hand, people were not surprised, as I mentioned earlier, because there's so much going on in the industry, and I think many on our teams feel very positive about this because it does give them some sense of stability and a real vision for the future. It's scary being part of a relatively small regional health plan these days. And so on one hand, I think our teams have been very positive in dealing with this really well. But even within that, there's an undercurrent of anxiety, and some people have been really candid about that. And my reflection on that, to some extent, is that when you go through, any company going through any kind of potential deal like this, whether it's a strategic affiliation or a merger or an acquisition, or whatever, there is a small core group of people, typically board members and executives, who are on the deal team and who are deeply steeped for months in the financial and operating details of the transaction, and you can't share the vast majority of that for good reason. And so there is, even I think in something like the Kaiser Group Health potential acquisition that makes so much sense from a evidence-based population management, same model of care, same mission and values perspective, there is concern about, well, what does it really mean? And with our teams having to be thoughtful about that right level of candor and transparency and sharing everything we can, but also needing to respect that there's a level of confidentiality that's important. It has been just a really interesting learning as we've walked. And I'm wondering how much of this depends on sort of what segment of the audience you're talking to in terms of the level of optimism versus some natural skepticism.
I would imagine the composition of this is, just by sheer numbers outside of the executive cabinet,
Exactly.
Just by, like I say, dint of numbers. Tony, I'm wondering, if you experience, or maybe you personally, but your organization experiences greater difficulty today finding great talent. I think it's always a challenge to find great talent. But is the composition, or is the combination rather, of this kind of fatigue and anxiety with some other general insecurities about the market, is that leading to a difficulty finding great talent?
Well, I think the talent proposition now is a real unique one. The reason for that is, for many years, everybody's just kind of thinking about their own channel, and they grew up in that channel, right? As we really started looking at this whole notion of coordinated care, population health, the leadership and the talent that we are looking for are those individuals that can go beyond that traditional channel of experience and competency and be able to broaden their thinking strategically, and so on and so forth, in order for them to be able to influence the teams that they're leading on a filter that's more broader, taking care of how we deliver health as opposed to just delivering health care, inpatient care, outpatient care, and so on and so forth.
Yeah. Pam, last night at dinner we talked about, there was about 24 or so, and there was general buy-in to the metaphor of healthcare being a dinosaur. The industry is sort of like a dinosaur. Big, slow to change, plodding, and there were all kinds of analogies of birds or bacteria or what's coming next, Homo sapiens, and we got a little bit off tangent, but There was almost uniform belief that there would never be a meteor. A meteor. There would never be a cataclysmic event that would kill the dinosaurs. And I thought that was really interesting irony that the conversation sort of bought into the analogy, but did not buy into the lesson. And one of the comments, and I think that analogy is reflective of it, is that maybe healthcare cannot move quickly enough. Because, group health is innovative, Providence is innovative, by definition, the exchange is innovative. Maybe you all can't move quickly enough. And I know that this is something at the exchange that's been hard, I think, watching from the outside, trying to figure out how to get through it all quickly enough. Do you think the exchange, or maybe not the exchange, maybe we'll talk about everybody else, do you think that healthcare as a general sector is able to move quickly enough to adapt before the meteor strikes? Or are we going to see some major disruption from outside of our industry that will change things?
I think it's going to be uneven. I think that some...
Hold on, can you bring her microphone up, Sam?
I think some organizations are really poised to make these changes. Some organizations are coming in new with a fresh idea, a fresh start, and I think that there will be disruption and successes, just as we've seen in other industries. I think that one of the problems in healthcare is there has been a lot of revenue, a lot of money, and there's some complacency that's related to maximizing those dollars, and there have been a lot of organizations who've been successful at just figuring out new ways to maximize the dollars. And as the revenue envelope shrinks, and you have lots of new patients coming in, but the revenue associated with them is much lower, it's going to be different kinds of organizations who are going to know how to capitalize on that and do well in that environment. And so some of the organizations that are on top now, they may not be in 10 years. They may not exist, or they may look very different, or they may be owned by different entities. But I don't think there's going to be a meteor, but I think we're going to see a lot of change over the next 10 years. And I think I used to always say, well, it will just implode on itself. Well, it's not going to do that. It's too big to implode. But it's definitely going to have to change. And I think we're starting to see some of those big changes now. And I think that's why you see some of the descriptions of people feeling anxious and frustrated, because this amount of change is scary.
Yeah. Tony, similar question, maybe building off of her comments. Pam talked about sort of the next 5 to 10 years and this rate of change. What are the things you're keeping your eye on in terms of the next 5 to 10 years? You mentioned population health, but I'm wondering if there are specific data points or trends or things that are maybe a little more micro that help underpin the overall macro trends, things that you're keeping your eye on over the next 5 to 10 years and how those might be manifest in terms of innovation in the market.
Well, I think we're looking at 5 to 10 years to continue to improve the way we deliver the care in the various channels of delivery. One of the amazing things today is we have like 4 different generations that are shopping healthcare, and each generation has a different need and want of what healthcare they're looking for, right? So for us, it's not just healthcare; it's how we improve health, and to that regard. Whether we are dealing with partnerships with organizations like Walgreens, whether we have a telehealth medicine program that uses a technology enabler to do so, whether we're able to really maximize or optimize the scope of the delivery that we have. And just to give you a perspective, we just looked at this. For 2014, new cases for 2014, we had 30,000 cancer patients, 35,000 cardiovascular patients, 25,000 neurosurgery patients, 27,000 digestive health patients, and we delivered 45,000 babies.
That's the only place babies are born, is it Swedish, I understand.
Well, this is Providence overall.
Yeah.
My point is that with that type of data set, you have a registry to do that. We have real competent experts on how we provide care. We're then actually able to create not only predictive modeling, but technology and innovation advancement so that we're actually making healthcare even more efficient and more effective as we go on. And we've taken a tack that, we will lead the industry in the innovation part and actually be disruptive and create our own destiny of how we're going to be delivering this value-based healthcare for many years to come.
Yeah. Erin, if I pose a similar question in a different way, which is everything is the same in 10 years. Nothing has changed, except for one thing. What is the one thing that you think will have changed in healthcare?
Ooh, that's a good question.
I just come up with this stuff.
I know, that's a hard one.
Yeah, I don't know.
What I hope will have changed is a far better integration with mental health. And that indeed is what I think it could be one of our most significant market disruptors. There's a lot of really good organizations working really hard, Group Health included, on integrating mental health services way upstream. In fact, we're even arranging for visits with therapists in the primary care medical office building in the primary care preventative care visit. And what kind of social determinants can we get better as communities about figuring out way upstream and preventing hospitalizations and all kinds of other not only unnecessary but potentially damaging impacts downstream. And I really think we have not cracked that nut well enough at all yet. And so I hope that the system aligns, the financing mechanisms, the care delivery systems, the community resource and structure around really transforming the way we think about getting upstream around mental health integration.
So I'll ask you all one final question, and same question. I think of each of you and your organizations as collaborative organizations by necessity. Maybe you don't want to be, but I think you are by necessity. I think you want to be also. Within the vein of trying to foster collaboration, working towards system improvement over time, what advice would you give to attendees here today? Erin, I'll ask you first. What should people here leave with as a result of today, but in thinking ahead for leadership in healthcare in 2016?
Be nimble. And, I think what I said earlier about this is a time that absolutely demands that leaders are able to put the patient first, put the consumer first, sort of put aside some maybe potentially, in my case, long-held beliefs about how things should be or how things are. And we've really had to, I think, dust off a lot of that and think in a much more open-minded way and be really good about responding to data, really good responding to what the market and the customer wants, and having that be the sort of first and foremost guiding star for us.
Yeah. Tony?
Yeah, I think along with that for leaders, I say three things. Very high emotional intelligence. Number two, you have to be able to really manage matrix relationships and matrix reporting lines, because partnerships and collaboration takes along that vein to make sure you understand that. And third and foremost is, you really have to be able to execute to plan.
Yeah. Pam?
I agree with both those answers, so I'll add something a little different, which is that I think today is just an incredible demonstration of kind of the collaboration between government and the private sector in healthcare. And government is one of the largest, if not the largest, purchaser of healthcare. And yet there sometimes feels that the delivery system and the health plans and this purchasing power, we don't really harness that potential to make changes. We get out of sync and start working on our own tracks. And I think if there was some ability in the next few years to kind of break down those walls and really start thinking about what could be accomplished if we all started to kind of work on the same goals in terms of changing the health system, I think we could make dramatic progress.
Great. Pam MacEwan, Interim CEO of the Washington Health Benefit Exchange. Tony Armada, CEO of Swedish Health Services. Erin Leff, Executive Vice President at Group Health. Let's give them a round of applause.